I'll never forget that day. My doctor's office had called me while I was at work. He asked me to come down to meet with him. He gave me the diagnosis, and I knew from that moment on my life had changed.
At Emanuel Cancer Center, an expert team of doctors, surgeons, nurses, and technicians help diagnose, guide, and heal cancer patients every day. Emanuel Cancer Center is proud to be accredited by the American College of Surgeons, a commendation that recognizes an elite group of national programs that show excellence in specific patient care areas, including positive patient outcomes, cancer prevention programs, and continuing clinical education. Located in our Emanuel Cancer Center, the Ruby E. Bergman Women's Diagnostic Center offers the latest advancements in the detection and treatment of breast cancer.
Here at the Women's Diagnostic Center, located in the Emanuel Cancer Center, we have the latest in technology. Everything from digital mammography to the region's only dedicated breast MRI, all in one convenient location in a beautiful day spa-like atmosphere.
A few of the Women's Diagnostic Center services include digital mammography, preoperative wire localizations, digital high-resolution targeted breast ultrasounds, core and vacuum-assisted breast and stereotactic biopsies.
As the radiologist and the medical director of the Women's Diagnostic Center, I specialize in breast cancer detection. This year, more than 200,000 women in the United States will be diagnosed with breast cancer. My stated mission is to increase the annual screening rate so that I can detect breast cancer at an early stage.
The dedicated breast MRI produces high-resolution imaging for the enhancement of early detection and offers maximum comfort for women as it contours specifically to a lady's body.
Women with an elevated risk of breast cancer are as follows. Those who are a carrier of the breast cancer gene, an untested first-degree relative of a carrier, women with a lifetime risk of 20% or greater, or a history of chest irradiation. These women should have an annual dedicated breast MRI as well as an annual mammogram beginning at age 25.
When women are diagnosed with breast cancer, our staff, especially our Breast Health Navigator, are outstanding in guiding our patients through the treatment process.
As a registered nurse and certified breast health navigator, I'll guide you through the diagnosis and treatment journey. I'll be your navigator, educator, and your friend.
From meeting with the patient and her loved ones to going with her to appointments, our Breast Health Navigator consults with women at risk for cancer and newly diagnosed breast cancer patients about their unique treatment process and what to expect.
From early detection to surgery to chemotherapy to radiation, Emanuel's Cancer Services are the best in the region, and our surgeons are some of the best in the nation. Our impressive Emanuel Cancer Care team includes Dr. Catherine Barton, who specializes in breast cancer surgery.
So surgery is the mainstay of treatment for breast cancer. Without it, there's no cure for breast cancer. When we talk about surgical treatment for breast cancer, we talk about two different options that are equivalent in terms of long-term survival, and that is a partial mastectomy or lumpectomy, where we take only the tumor out and conserve the breast, or mastectomy, where we take off the entire breast. In addition, at the time of surgery, we have to look at the lymph nodes. The way we do that is to take out a couple of the lymph nodes, the first ones that drain the breast, to determine if there's any cancer there. If there's cancer in those lymph nodes, we do go forward with taking more lymph nodes out, called an axillary lymph node dissection. When we decide to take out just the lumpectomy, there are different ways we can do that if it's not a palpable tumor. One is to use intraoperative ultrasound. Another is to use a wire placed by the radiologist prior to surgery. This is especially true when it's not able to be seen on ultrasound.
Breast reconstruction is a viable option for many breast cancer patients. This is a coordinated effort between a plastic surgeon and a breast cancer surgeon. I frequently operate alongside the breast cancer surgeon to start the reconstructive process. The patient may go into the operating room with a diagnosis of breast cancer. She will return a few hours later, cancer-free and a new breast.
At the Stanford Emanuel Radiation Oncology Center, we bring state-of-the-art cancer care to the region that patients used to have to drive to the Bay Area to seek.
The center is a joint venture with Stanford University School of Medicine, Stanford Hospital and Clinics, and Emanuel Medical Center. The Stanford Emanuel Radiation Oncology Center includes the $3 million Varian Trilogy Linear Accelerator. It utilizes IMRT technology, which focuses therapeutic radiation in the exact places where it's required, while minimizing the radiation to healthy tissue. The latest in technology to be added to the center is high-dose rate HDR brachytherapy. Conventionally, women receiving HDR radiation therapy for breast cancer undergo 6 to 7 weeks of daily therapy. However, with HDR brachytherapy, radiation therapy takes place twice a day for just 5 days under the watchful eye of the Stanford Emanuel radiation oncologist and physics team.
In addition to radiation, Emanuel Cancer Center is home to medical oncology services.
Medical oncology services at Emanuel Cancer Center consist of the diagnosis, treatment plan for all newly diagnosed cancer patients. When cancer patients and their families arrive to a consultation in medical oncology, we provide them information about their diagnosis and treatment plan. Now, this treatment may consist of radiation therapy, chemotherapy, surgery, or a combination of all of these treatments. The benefit of this is that the patient and their family can receive care here at Emanuel Cancer Center under one roof.
Emanuel Cancer Center also offers a tremendous amount of resources patients can't find anywhere else in the area. With an expansive cancer library, patients can access the internet and even learn about clinical trials, like the trial being conducted at our cancer center. They can also participate in our support groups for themselves and their loved ones.
Could you be at risk for breast or ovarian cancer? How do you know if you have a genetic predisposition?
Women with a family history of breast cancer or ovarian cancer who started menstruation earlier than normal, had children after the age of 30 or no children at all, previous biopsies or a previous biopsy that showed atypical cells, are encouraged to schedule an appointment with our Breast Health Navigator and take our complimentary Women's Cancer Risk Assessment. For women who are calculated as high risk, it may be appropriate to receive genetic counseling.
As your genetic counselor, we'll talk about what's right for you. For example, testing of the BRCA1 and BRCA2 genes. Women that inherit a change in one of these genes may be at increased risk for breast and ovarian cancer.
Awareness and preventive care are key to maintaining your health. If you, your girlfriend, daughter, or mother are interested in taking the Cancer Risk Assessment, it's available free of charge at Emanuel Cancer Center. I will guide you every step of the way.
The team at Emanuel Cancer Center changed my life. You may change the life of a lady you love by sharing the gift of life. Emanuel's Complimentary Cancer Risk Assessment. Invite her to phone Emanuel Cancer Center at 664-2434 to schedule her consultation.
Emanuel Cancer Center. Technology to heal, compassion for life.